Welcome to our session on the key components of complexity-based evaluation and management. This session will focus on exam, which is one of the three key components used to meet a complexity-based service. You will want to make sure to review the other sessions for history and medical decision-making, which are the other two key components for reporting a complexity-based E&M code. My name is Stacy Olson, and I'm a certified professional coder with a specialty credential in evaluation and management services through the American Academy of Professional Coders. CPT is the code set that is used to report professional medical services, and evaluation and management codes are included in CPT but are a small portion of the code set. CPT codes are developed, maintained, and copyrighted by the American Medical Association. Every attempt has been made to provide you with accurate and current information. However, the coding rules can and do change, and it is always the provider's responsibility to know what the state and federal rules are and to remain current on payer policies. Today's information is not legal advice or a reflection of any individual health system's policies or procedures. It is not instructing providers in what services they may perform and/or bill, but is meant to inform you of general knowledge and best practices for billing and documenting medical services. Our objectives in this session will be to differentiate between the 1995 and the 1997 CMS documentation guidelines for exam. We will calculate the level of exam in a case study using the auditing tool provided by WSPA for the 95 and the 97 documentation guidelines. We will illustrate the E&M CPT codes that would be supported for the E&M level that we obtain in our case study. How the levels of exam are quantified in the CMS 1995 guidelines and 1997 guidelines is different, and this is currently the only difference between the two sets of guidelines. Prior to September 10, 2013, there were also differences in how the history was calculated, but CMS has since put forth guidance that history is now calculated the same way under both sets of guidelines. Both sets of the guidelines require findings in organ systems and body areas. However, the 1995 guidelines do not require any specific number of findings for a body area or organ system. The 1995 exam guidelines are much more subjective, and some organizations may choose not to use them for this reason. The 1997 guidelines specify certain exam elements, also known as exam bullets, that would be assigned to each organ system or body area. They also specify how many of these bullets must be performed and documented in a certain number of organ systems and/or body areas for each level of exam. Some providers feel that the 97 guidelines are much more restrictive because they are so precise about how to quantify the levels of exam. CMS states that providers may choose either set of guidelines to determine the level of exam for their encounter, but that the 95 and 97 guidelines cannot be combined for the same encounter. If you are working with a health system, the organization may have a policy in place about which set of guidelines they want their providers to use, and other organizations will allow the provider to decide for themselves. The provider should always perform the exam elements they feel is appropriate using their clinical judgment based on the patient's history and nature of the presenting problem. Just make sure that the exam that is being performed and documented is within your scope of practice and that it makes sense medically. For instance, it would be extremely unusual to examine the patient's ears if they present for ankle pain and have no other complaints. Both sets of the guidelines require providers to elaborate on any abnormal exam findings in relation to the chief complaint and any abnormal findings in asymptomatic body areas or organ systems. Notations of abnormal without elaboration are insufficient. All relevant negative findings of the affected or symptomatic body area or organ system should also be documented. If findings in a body area or organ system are negative or normal, It is acceptable to use these terms in unaffected body areas or asymptomatic organ systems. Both sets of guidelines include the same levels of exam and both give the vague descriptions listed in this table. A problem-focused exam is defined as a limited exam of the affected body area or organ system. An expanded problem-focused exam is a limited exam of the affected body areas and/or organ systems and other symptomatic or related systems. A detailed exam is defined as an extended exam of the affected body area and/or organ system and other symptomatic or related systems. And a comprehensive exam is a general multi-system exam or a complete single organ system exam. Both sets of guidelines go on to state how many body areas and/or organ systems need to be performed and documented. But the 97 guidelines go on to specify how many findings are required in those body areas and/or organ systems for each exam level. We are going to review the 95 exam guidelines first. 95 guidelines list the countable organ systems as constitutional, eyes, ears, nose, mouth, and throat, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, skin, neurologic, psychiatric, hematologic, lymphatic, and immunologic. The body areas are listed as head, neck, chest, which includes the breasts, abdomen, genitalia, including the buttocks, back, which includes the spine, left lower and left upper extremities, and right lower and right upper extremities. The 95 guidelines do not specify how many exam findings must be documented in each organ system or body area for the provider to receive credit for that organ system or body area. Some organizations will put their own criteria in place about how many findings must be documented in each system or body area if they feel that this will minimize their risk if they should come under payer scrutiny. This table shows the 4 levels of exam and what CMS says is required for each level of exam in the 1995 guidelines. A problem-focused exam consists of findings for one body area or organ system. For expanded problem-focused and detailed exams, CMS lists both of these as 2 to 7 body areas and/or organ systems. Some organizations will define it further for their providers and say that 2 to 4 body areas and/or organ systems are required for an expanded problem-focused exam, and that 5 to 7 body areas and/or organ systems are needed to meet a detailed exam. CMS states that 8 or more organ systems are needed for a complete multi-system exam, or that the provider can document a complete single organ system exam. The 1995 guidelines do not quantify what a complete single organ system exam consists of. So again, the 1995 guidelines are very subjective when it comes to the exam. Now, it's a bit strange that the quantification of the exam can be a mix of body areas and/or organ systems for the 3 lower levels. But when we look at comprehensive, it just states 8 organ systems. Depending on what is documented about a body area, the body area can most likely be credited back to an organ system. For instance, in the lower extremities, which are listed as body areas, if the provider documents that there is normal sensation and reflexes, that is a countable element to the neurologic system. Or if the provider documents there is normal range of motion and the lower extremities are non-tender, then that is a countable bullet to the musculoskeletal system. Coders and auditors will credit the organ system that the exam finding belongs to. For example, if edema is listed under the musculoskeletal system or skin, it is still credited under the cardiovascular system. Muscle strength and tone are musculoskeletal exam bullets, even though they may be listed under neurologic. This slide shows us the requirements for the 97 exam guidelines. As you can see, they are much more concise in what must be documented for each exam level for both the general multi-system exam and the single organ system exams. Let's look at the general multi-system exam levels first. Problem-focused exam states 1 to 5 elements identified by a bullet in one or more organ systems or body areas must be performed and documented. An expanded problem-focused exam requires at least 6 elements identified by a bullet in one or more organ systems and/or body areas. A detailed exam must have at least 6 organ systems with at least 2 elements identified by a bullet, or 12 elements identified by a bullet in 2 or more organ systems or body areas. And for a general multi-system comprehensive exam, at least 9 organ systems or body areas must have all elements of the exam identified by a bullet, or at the very least 2 elements identified by a bullet in 9 body areas or organ systems. Unlike the 1995 guidelines, the 97 guidelines define what constitutes a single organ system exam for each level. For each level of single organ system exam, it talks about shaded and unshaded borders. The 97 guidelines contain single organ system exams for the cardiovascular system, ENMT, eyes, genitourinary for males and females, musculoskeletal, neurologic, psychiatric, respiratory, skin, and hematologic, lymphatic, and immunologic. When you review the guidelines for these single organ system exams, there are shaded and unshaded areas in each single organ system exam. So that is what is being referenced in this table. The problem-focused exam in a single organ system requires 1 to 5 elements identified by a bullet in shaded or unshaded borders. An expanded problem-focused exam requires 6 or more elements identified by a bullet in either the shaded or unshaded borders. A detailed exam would need 12 or more bullets in shaded or unshaded borders for all of the single organ system exams, except the single organ system exam for eyes or psychiatric, which will require at least 9 elements identified by a bullet. The single organ system comprehensive exam requires all elements identified by a bullet in shaded and unshaded borders, or every element in each shaded border, and at least 1 element identified by a bullet in each unshaded border. The 97 guidelines are very specific about what bullets are considered countable in which organ systems and body areas. Documentation for each element must satisfy any numeric requirements, such as measurement of 3 of the 7 vital signs. Bullets with multiple components listed, but no specific numeric requirement, need to have at least 1 finding under that bullet. For example, under eyes, one of the bullets listed states exam of the pupils and irises. So if just the pupils are examined, the provider can still receive credit for that bullet, even though the irises were not examined. So let's look at the elements identified by a bullet for each organ system and body area under the 97 guidelines. Under constitutional, we see measurement of 3 vital signs, which may be recorded by ancillary staff and reviewed by the provider, as well as the patient's general appearance. Exam bullets for the eyes list inspection of conjunctiva and lids, exam of the pupils and irises, and exam of the optic disc and posterior segments. Under each bullet, they list examples of findings that may be recorded for each bullet. Ears, nose, mouth, and throat list bullets for external inspection of ears and nose, exam of the external auditory canals and tympanic membranes, assessment of hearing, inspection of nasal mucosa, septum, and turbinates, inspection of lips, teeth, and gums, exam of the oropharynx, oral mucosa, salivary glands, hard and soft palates, tongue, tonsils, and posterior pharynx. Gastrointestinal includes bullets for exam of the abdomen, exam of the liver and spleen, exam for presence or absence of hernias, exam of the anus, perineum, and rectum, and obtaining a stool sample for occult blood test when indicated. This slide shows the exam bullets for 4 separate body areas and organ systems. The neck has bullets for an exam of the neck looking for masses, symmetry, and appearance. It also has a bullet for exam of the thyroid. Chest, which is really exam of the breasts, has bullets for inspecting for symmetry or nipple discharge, and palpation of the breast looking for masses, lumps, or tenderness. Skin has bullets for inspection of the skin looking for rashes, lesions, or ulcers, and palpation of the skin or subcutaneous tissue. Under lymphatic, it specifically states that palpation of 2 or more areas are required. The body areas listed under lymphatic are the neck, axilla, groin, or other. And for other, the provider should specify which lymph nodes are being examined. The respiratory system contains bullets for assessing the patient's respiratory effort, percussion of the chest, palpation of the chest, and auscultation of the lungs. Cardiovascular bullets include palpation of the heart, which is often documented as PMI or point of maximum impulse, auscultation of the heart, notating any murmurs or abnormal sounds, exam of the carotids, abdominal aorta, femoral and pedal arteries, and examining the extremities for edema and varicosities. Genitourinary exam has separate exams for males and females. For men, the bullets consist of exam of the scrotal contents, penis, and digital rectal exam of the prostate. For women, there are bullets for exam of the external genitalia, which includes the vagina, exam of the urethra, bladder, cervix, uterus, adnexa, and parametria. Neuro has bullets for cranial nerves, reflexes, and sensation. And psychiatric has bullets for judgment, orientation to time, place, and person, memory, and mood and affect. And lastly, the musculoskeletal system has bullets for gait and station, inspection of the digits and nails, and then exam of joints, bones, and muscles, which lists 6 areas that may be examined. Those 6 areas are the head and neck, spine, ribs, and pelvis, the right upper extremity, the left upper extremity, right lower extremity, and the left lower extremity. CMS states that an exam of a given area should include inspection and/or palpation looking for misalignment, asymmetry, crepitation, defects, tenderness, masses, or effusions. It also has assessment of the range of motion, assessment of stability, and assessment of muscle strength and tone. Over the next 2 slides, we have a case study that we are going to quantify under both sets of guidelines. This example was taken from a family medicine provider and is more extensive than what a pharmacist might perform, but for education purposes, I thought this would be a good example to show you. Vitals are documented as well as the general appearance of the patient, and both of these findings are counted toward constitutional. The head is documented as normal cephalic, atraumatic, and is counted toward the body area of head. Conjunctiva, lids, and pupils are all considered to be bullets under the exam of the eyes. Ears, nose, and throat is documented with normal findings in the auditory canals and tympanic membranes, as well as the oral cavity, tongue, and tonsils. Neck is supple, no masses or cervical lymphadenopathy. Neck can be counted for supple, no masses, and the cervical lymphadenopathy can be counted to the lymphatic system. Cardiovascular has normal rate, rhythm, and heart sounds. No gallop or murmur is present. So on this slide, there are findings for 5 organ systems and 2 body areas. The respiratory system has normal effort and breath sounds. The abdominal exam has findings stating it is soft and non-tender. There are normal bowel sounds. There is no distension, mass, rebound, or guarding. and all of these bullets are counted toward GI or the abdomen, but not to both. Musculoskeletal states the lower extremities have normal range of motion, no edema, and no tenderness. Edema is not considered to be a musculoskeletal exam bullet, but rather is counted toward the cardiovascular system. Neurologic is documented as alert and oriented ×3 without cranial nerve deficits and exhibits normal strength and tone. The strength and tone are counted toward musculoskeletal, not neuro. Skin is warm and dry. There is no rash, pallor, or bruising. No bruising could be counted toward the hematologic system. And psychiatric has findings of normal mood and affect, behavior, judgment, and thought content. This slide has exam findings for 8 organ systems. However, we have already credited the cardiovascular system on the previous slide, and the edema does not get credited again. So really, we have another 7 organ systems for the documentation on this slide. So let's apply the case study to both sets of guidelines and see what our level of exam is under each of them. Using the WSPA auditing tool for the 1995 exam, we can see that we have findings in 2 body areas and 12 organ systems, and we have more than exceeded what is required for a comprehensive exam under the 1995 guidelines. Our body areas were the head and the neck, and our organ systems were constitutional, ENMT, cardiovascular, eyes, GI, hematologic, lymphatic, neuro, psych, respiratory, and skin. Now let's apply the case study to the 97 guidelines and see if we are able to reach the same level in that set of guidelines. I have taken the bullets that we reviewed earlier and put them into a table format over the next few slides. Bullets in purple are the bullets that were supported by the case study. For constitutional, we documented a total of 6 vital signs, and we meet the criteria of 3 or more, and we had the patient's general appearance documented as well-developed and well-nourished. That gives us a total of 2 bullets in the constitutional system. There are also 2 exam bullets for eyes, which were the conjunctiva and lids and exam of the pupils. 2 bullets are documented in ENMT with findings for exam of the auditory canals and tympanic membranes in addition to the oropharynx. Under neck, we met 1 bullet for documenting the neck was supple and no masses were noted. We did not have any exam of the breasts. So on this slide, we have a total of 3 systems with 2 bullets and 1 body area with 1 finding. The respiratory system has 2 bullets for normal effort and breath sounds. Cardiovascular also has 2 bullets for auscultation and edema. Remember, the provider had documented the edema under the header of musculoskeletal, but it is counted in the cardiac system. There is 1 bullet under GI for exam of the abdomen. The provider did not do a genitourinary exam. So on this slide, we have another 2 systems with 2 bullets. Remember that we need 2 bullets in 9 systems to reach a comprehensive exam in the 97 guidelines, and right now we are up to 5 systems with 2 bullets. Respiratory has 2 bullets for normal effort and breath sounds. Cardiovascular also has 2 bullets for auscultation and edema. Remember, the provider documented the edema under the header of musculoskeletal, but it is counted in the cardiac system. There is 1 bullet under GI for exam of the abdomen. The provider did not do a genitourinary exam. On this slide, we have another 2 systems with 2 bullets. Remember that we need 2 bullets in 9 systems to reach a comprehensive exam in the 97 guidelines, and right now we are up to 5 systems with 2 bullets. Lymphatic states palpation of 2 or more areas are needed. We had 1 area, which was the neck. We had both bullets in skin, for documenting that the skin was warm and dry and there was no rash, pallor, or bruising. Musculoskeletal documented 2 findings in the bilateral lower extremities under the musculoskeletal system, and muscle strength and tone was documented as well, but the provider listed that bullet under his neurologic exam. So we have 2 body areas with a total of 3 bullets in each of the areas under the musculoskeletal system. Neuro documents 1 bullet for no cranial deficits, and psychiatric has 3 bullets for the patient's judgment, mood, and affect, and the provider states that the patient is alert and oriented ×3 under his neuro exam, but it is counted as a psychiatric bullet in the 1997 guidelines. So we have another 3 organ systems that have 2 or more bullets documented on this slide for a total of 8 organ systems with 2 or more bullets. For our case study under the 97 guidelines, we are only able to reach a detailed exam because we had 2 bullets in 8 organ systems or body areas, and the 97 guidelines require 2 bullets in at least 9 organ systems or body areas to meet the criteria for a comprehensive exam. I wanted to show you at least one example for a single organ system exam as well. This slide represents what CMS states is required for a single organ system exam in the cardiovascular system. Remember, we were talking about shaded and unshaded borders at the beginning of our discussion regarding the 97 guidelines. If you go to the single organ system exam in the 97 guidelines, it lists the bullets on this slide as crediting towards the cardiovascular exam. Remember that the comprehensive single organ system exam requires all elements identified by a bullet, or every bullet in each box with a shaded border, and at least 1 bullet in each box with an unshaded border. As you can see, we did not meet the comprehensive option for a single cardiovascular exam using either of those options. We do have a total of 12 bullets, and that would give us a detailed exam under the cardiovascular organ system. So if we apply our findings to the grid for 1997 on your auditing tool, we would circle detailed under both the general multi-system exam and the single organ system exam. It is not necessary to try and calculate the level of exam under a single organ system, but for the purposes of this education session, I thought this would be a good way for you to learn about how that single organ system exam is quantified. As we look at the grids over the next several slides, keep in mind that the other key components will need to be met too, as defined by CPT. But the exam in this case study would support these levels. In an outpatient or office setting, we would be able to reach 99203 for a new patient and 99214 for an established patient under the 97 guidelines. Under the 1995 guidelines, we have enough exam findings to support either 99204 or 99205 for new patient codes and 99215 for an established patient code. In a domiciliary or assisted living setting, we could reach 99236 for a new patient and 99336 for an established patient under the 97 guidelines. Under the 1995 guidelines, we have enough exam findings to support either 99327 or 99328 for new patient codes and 99337 for an established patient. In the home setting, we would be able to obtain 99343 for a new patient and 99349 for an established patient under the 97 guidelines. For the 1995 guidelines, we have enough exam findings to support either 99344 or 99345 for new patient visits, and we would have 99350 for an established patient exam. In an inpatient hospital setting, we could reach 99221 for an initial care visit and 99233 for a subsequent visit using 1997 guidelines. Under the 1995 guidelines, we have enough exam findings to support any of the initial care visits, 99221 through 99223, and we would meet 99233 for a subsequent visit. In a nursing facility, we would be able to reach 99304 for an initial care visit and 99309 for a subsequent visit using 97 guidelines. In a nursing facility, we would be able to reach 99304 for an initial care visit and 99309 for a subsequent visit under the 97 guidelines. Under the 1995 guidelines, we would have enough exam findings to support any of the initial care visits, 99304 through 99306, and we would meet 99310 for a subsequent visit. Our exams for consultations under the 1997 guidelines would support 99243 for an outpatient setting and 99253 in the inpatient setting. The exam under the 95 guidelines would meet criteria for either 99244 or 99245 in the outpatient setting, and the inpatient setting would have enough exam to meet the criteria for either 99254 or 99255. Here are my sources for this session. I recommend you read them for yourselves for a thorough understanding of the guidelines. If you work for a healthcare organization and have a coding educator available to meet with you, I would encourage you to do so to understand the organization's policies and procedures regarding E&M coding. Thank you for listening to our session on exam. I hope that it has helped you to understand how the clinical findings you document are used to support exam levels as defined by CMS and CPT for the E&M codes.